to throw some light on what treatments are actually essential and which ones are non-essential?
Yeah, so people think that braces or orthodontic treatment is just to make us smile better. What they don't know that when parents think, and so a lot of parents think, oh, my child's smile is good, my child doesn't need orthodontic treatment. So orthodontic treatment can be only aesthetic or just purely cosmetic, and it can also, in more cases, in fact, more number of children, it is aesthetic but also functional, which means that there are issues that need to be sorted, which if not fixed at a certain age can be damaging to your dentition. So I don't know if you know this, but orthodontists are also called as dentofacial orthopedists, which means that we can actually modify the size and the position of the jawbone, the upper and the lower jawbone, but it can only be done during the early growth period, or I would say between 7 to 14 years of age. Now, when do we need to do that? When you have a small upper or lower jaw, if you have a narrow jaw. Now, why do you need to fix this other than purely aesthetics? It can affect big reasons. It can affect your chewing, mastication, but in a lot of people, you can have major issues when you get older. For example, a smaller lower jaw can constrict your airway. It can lead to sleep disorders like sleep apnea, which a lot of people are now getting familiar with. A small narrow jaw can cause mouth breathing in children. It can lead to nasal obstruction and other nasal pathway related disorders. So there are so many things that we have to look at in growing children. We need to make sure that the jawbones are developing well, and these are the essential treatments. Even if you don't have a jaw disorder or you don't need orthopedic treatment, just having straight teeth, helps you in maintaining great oral hygiene and make sure that you can retain your natural teeth throughout life, which itself is a big benefit of orthodontic treatment. So yes, there could be like some treatments which are purely cosmetic and very mild, and which are sometimes we do just because, the child or the parent wants it. Sometimes you have parents that want that. But in most cases, the children do need treatments which are essential. And so seeing an orthodontist becomes essential there. And like, Priya was saying that it is from within. So when I see a child, before I ask the parent, I always ask them, what is your chief concern? Do you have an issue with your smile, or do you think you want to fix something? And that's when I get the answer. I know, okay, I have to fix this for this child.